Republicans are also taking aim at one of the more controversial parts of the healthcare system, Medicaid. The woman nominated to head the Centers for Medicare and Medicaid helped shape Indiana's Medicaid program. She was able to cross the aisle and work with both Republicans and Democrats. And as Bertha Coombs reports, many see her work as a potential blueprint for the GOP's reform plans.
When crippling back pain forced Robin Henderson to leave her job last year, Medicaid was a godsend.
If I didn't have the coverage, I would be in trouble.
She was covered through the Healthy Indiana Plan, or HIP, the state's version of the ACA's Medicaid expansion. The architect behind HIP is Indiana consultant Seema Verma, brought in by then-Governor Mike Pence. She has since helped design Medicaid expansion plans in several states headed by Republican governors like Iowa and Ohio, governors who did not support most other provisions of the Affordable Care Act. Now she's President Trump's pick to head the Centers for Medicare and Medicaid, so she'll be deeply involved in the administration's plans to repeal and replace the Affordable Care Act. Back home, Verma gets high marks for working across the aisle.
Every time you encounter her, it is for what is our ability to solve the problem and how do we obtain that solution, and she drives for that on a regular basis.
She was a very good listener and was able to put a lot of different perspectives kind of into the mix.
But Verma has also come under fire by some policy experts for requiring low-income HIP enrollees to contribute up to 2% of their income toward premiums and devising a plan that pushes them out if they fall behind.
If you don't pay your premium on time or you don't get your paperwork in on time, even if you go back and say, I'm going to pay my premium, you're actually locked out of the program for 6 to 12 months.
Republicans in Congress are looking to rein in federal funding for Medicaid, but in the states, even some Republican governors, like Indiana's Eric Holcomb, have cautioned that those cuts will have a big impact on their budgets.
What happens to the Medicaid program writ large, for example, if spending is capped, potentially could layer on top of an ACA repeal. That will simply be a huge cost shift to the states.
Hospital and nursing home reimbursement could be hardest hit under Medicaid cuts in Seema Verma's hometown. Executives are hoping she can help build compromise in Washington to limit the pain.
There's been a lot of discussions about how bipartisan this needs to be. We are optimistic about what that means.
HIP enrollees like Robin Henderson are hoping they won't lose their lifeline.
It's important to have health insurance. It's hard not to have it.
Bertha Coombs, Nightly Business Report.